welcome. Welcome to Staying Active at Home. My name's Amy, and I'm a physiotherapist at the Hamilton Family Health Team. So this is our topic for today. I can explain a few technical things. Here we are on Zoom. You can see me, hopefully. You can use the chat, so you can use that to ask me a question. I believe only I can see it. If it says send to panelists, then I can see it. If it says attendees, that's everybody. So go ahead and ask a question as it comes up. I will do my best to answer on the go. Or I might have to wait a little bit till it might fit in, or I might know that I'm addressing it later. So please do that to ask a question, make a comment. That's wonderful. And then, yeah, if there's any technical issues, there hasn't been lately, so I apologize if my connection goes up and down. Just give it a second. I should come back. You can always let me know in the chat if I froze up or something, and then I'll repeat myself. Okay, so welcome. So like I said, my name's Amy and I'm a physiotherapist. And so part of my job at the Hamilton Family Health Team is working with people. And part of almost every interaction, we're going to talk about physical activity. We're going to talk about staying active. It's really important for many, many reasons. But the two that I really focus on are that it is great for helping manage a lot of health conditions or helping preventing them from becoming issues. And then the other thing, and probably the more important thing, is it gives me a way to help people do the things that they want to be doing. Keep you active, keep you engaged, keep you doing some interesting things. So that's definitely going to be our focus today. So here's our bit of a brief view of our agenda. We're going to talk about why exercise, why activity are important. We're going to go over some strategies about how to, bring that into your everyday life, especially now that we're at home more. And then I'm also going to share a couple of resources, give you a bit of a further, explore some other things or places to get started. So that's going to be our goal for today. I will share any links in the chat. Everything I'm showing you is pretty easy to find by searching too. So, but yeah. I'm going to share my screen sometimes. I'm going to show you a video. So we'll just see how it goes. So first off, bit of a, not even a disclaimer, but I think it's important to talk about safety right off the bat. So exercise or physical activity is safe for most people, most health conditions. I'm going to tell you a few times where it's probably a good idea to talk to your doctor first and get the approval. And I'm even going to share a tool that helps you decide if it's safe or if you should talk to your doctor first. So if you have a new issue that it's not under control or you don't have a good explanation for yet, that might be something you should talk to your doctor about first. So examples would be if you've been having new episodes of fainting or your heart racing or any kind of chest pain without an explanation, without any management strategy. If you're feeling short of breath, if it's hard to catch your breath with even simple activities like walking across a room or standing up from a chair, then that would also be a sign to tell your doctor about that right away, and then also just get that bit more instruction before you jump into any activity. Of course, if your doctor has told you not to exercise, then it's important to follow those instructions as well. So let me share with you, I'm going to share my screen so you can see this tool. It's a Canadian, just a little questionnaire that helps you try to understand if exercise is safe for you or if you should talk to your doctor first. So it's called PAR-Q Plus online. So PAR stands for Physical Activity Readiness. Q is for questionnaire. And so I will put this in the chat. Basically, you'll click this button and it'll ask you those questions, kind of what I went over, but a bit more in detail. And then at the end, it'll say, talk to your doctor, or, oh, it's safe to get started, things like that. So that can be a really helpful way to just feel confident. So if that's a question for you, if you're not sure, sometimes this is a really great addition. So that's what that website is about. And let me put that in the chat. Okay. It's great too because I didn't plan it this way, but all the tools that I share are Canadian, so I like that. It was the first time I did it, and I'm like, oh yeah, of course, great. So it's good, it's nice. So that's just a little bit about safety, and I'll bring safety up again here and there as we talk about other things, but definitely we want to make sure we're feeling safe. So some definitions. What is exercise? Well, I'm going to compare it to two other things as well. So we have exercise, physical activity, and movement. So movement, I think, makes sense. I think we can all grasp what that is. It means moving my body. It's the opposite of sitting still. I think we've heard in the media a lot over the past, it's been a while now, a little bit about sitting, about our sedentary behavior. So movement would be the opposite of that. And one thing I definitely encourage everyone to do is to find opportunities in their day if you've been sitting a long time, even just standing up. Move a little bit, walk across the room, or just in your chair, get a bit of arm movement, get a bit of marching on the spot. So, movement would be exactly that, just movement of any body part. Doesn't have to last very long. And thinking about safety, I'm sure everyone participating online has some movements that are safe for them. So that would be a great place to start, adding some movement breaks. It's really tough on our bodies if we sit for a long period. Maybe you've noticed, you sit down, you're relaxing, and before you know it, you're like, oh, my back is stiff from being on the couch, right? So the best thing you can do is every half hour, every hour, get up, do a little bit of movement, or move in your seat, and then you've broken it up, right? So you've given your body a little bit of a break. So that's movement. Great place to start, definitely safe for everyone. So that's number one. Now, if we do movement for a longer period of time, right? If we keep moving, then we're getting into the activity, physical activity or active range. So that would be more continuous rather than just a couple, 5 movements. We might have minutes of movement, so where we keep it going. And activity, it might be that you're trying to get something else done. So for example, some people walk to the store. So that would be an example of physical activity, or gardening, right? So your goal there isn't necessarily exercise, but you're doing an activity that has sustained or continuous movement. So activity is also a great thing to think about, because there's probably some activities that you already do that are safe for you. So that's, again, linking it back to safety. There are definitely some activities that you're probably doing. So if it's like, oh yeah, I go to the store and walk at the store, and that takes me 20 minutes, then you have a sense of what is already in your realm of, okay, this works for me. So that's another thing you can think about. And now if we come to exercise, so it's just like movement was a part of activity, activity is a part of exercise. Exercise just brings more structure, and it brings a more specific reason. So exercise would be structured, and the goal there is fitness, rather than, you can get some physical activity when the goal is something else. But with exercise, it is kind of its own activity. Sorry for all the back and forth with language. But yeah, exercise is more structured, and you might be thinking a bit more about how hard you're working. But I think that's something that you can bring to the physical activity that you already do. So brings me to my next point. Thinking about how long you should exercise actually is going to be first. So Canadian guidelines do recommend 150 minutes a week. I think when I say that to people, that's pretty intimidating. That sounds like a lot of minutes, and it is. If you can do even, I like to break it down into 10-minute chunks. So if you can think about being active for 10 minutes at a time, then you can get a lot of the same health benefits. A lot of recommendations are to do it for half an hour. But even if you can do 10 minutes, you're starting to get some of the health benefits, and 10 minutes seems doable. Like if I'm having a day and I don't have any activities planned, maybe I can get out for a 10-minute walk, even if it's short, in my neighborhood, or something like that. So it seems it's much more doable, and that's going to be key, because if we can actually get it done, we have a starting point. If we say 150 minutes and then we don't meet it and we don't do it, then we haven't even started. So I do like to think in 10 minutes, and maybe you can ask yourself, can I get 10 more minutes this week? Spreading it out is also really good. So it doesn't have to be all together or just a couple days in a row. The best is if you can keep it regular. So every other day, that's another thing to think about. Instead of 3 days in a row of a lot of activity and then nothing for 4 days, it's better to have a little bit every day. And even if 10 minutes is overwhelming, remember what I said before about movement. So movement breaks, taking a bit of time to add movement in when you've been sitting for a long time, that creates a lot of health benefits too. Different scale, different kind, but definitely you'll feel better for moving. So then the other question is, how hard should I work? So this is also important. I like to try to describe different levels of effort. So pretty easy to think about light effort, medium effort, and hard effort. And then how do you know? How do you know what's hard? How do you know what's medium? So one handy little trick is to think about how well I can talk. So if I were working at a light effort, like sitting here right now, I should be able to sing. So I have enough breath that I could sing. That takes more, I need more air. I need to be able to fill my lungs. So if I can sing, then I'm probably working at a light effort. I'm not getting very sweaty. I'm not getting much hotter than if I were just sitting and not doing any movement or doing any activity. So that's one way you can think of light. And really some activities can be light or medium or hard. So walking, for example, it's a great example. You could be walking just nice and slow, flat ground, kind of sauntering, meandering. Maybe you're looking at the flowers. Sounds lovely. That might be light effort. If you pick the pace up a little bit, you might start to get into medium effort. So medium effort, you might start to notice you're getting warmer. You might start to notice you need to take a breath sooner. Your breathing's getting a little bit faster, but you still can talk. You can still carry on a good conversation. You might take a more noticeable breath here and there, but you should be able to speak in sentences or close to sentences, that kind of thing. So we call it the talk test. So light effort, I can sing. Medium effort, I can still talk. And then when we get into hard effort, it's harder to talk. Of course, I could still get words out, but maybe it's only 2 or 3 before I have to take a breath, and my breathing is getting really hard and I'm really getting warm and I'm really sweating. So light effort is very safe. That's what we have to do just to, get our breakfast ready and things like that. Medium effort is also very safe, and it's where most of our activity should be. Medium is really the goal. And then, of course, hard is really, we're getting into exercise. We're getting into people who are practiced and at exercise and already wouldn't be where I would start. And even if you are an athlete, you don't spend that much time at the hardest effort level. So lots of room for variation in that medium ground. And that's important to think about too, because we sometimes we think we're working hard, but it kind of drops off. So it's something to think about when you're trying to be active, to make sure that you're actually challenging yourself a little bit. I'm not a fan of little challenges, not giant challenges. So thinking about your effort is a great step. I think we've kind of defined a lot of things. We've talked about safety. We've talked about what is exercise and, what's a good amount of time and what's good effort. That's all well and good, but most people, the hardest part is getting started. So like I said, so we'll talk a little bit about that. And definitely this idea of motivation, I think, is a really tough one. You hear it a lot. Well, I'm just not motivated. I don't know. Or you see someone, you're like, how are they so motivated? How did they just get out there and do it every day? I saw a very interesting talk sometime last year, maybe a year and a half ago, and he talked about motivation, and it was really interesting. He said, we expect that it should come first before I do a thing, but really it comes after. And this made a lot of sense to me. If we wait for motivation, it doesn't just come out of thin air. And in fact, I know for me that I did realize that the things I'm motivated to do are the things I already do or have done in the past and know I enjoy them. So, and it also gives you license. You realize, okay, if I'm waiting for motivation, maybe that will never come, so I better just start anyway. So I thought that was a helpful way to think about it. And in that case, you can just schedule it. For some people that works. Put it in your calendar, even if it's 10 minutes, just put it in there, set that appointment for yourself, and or set a goal like, oh, on by this date, I'm going to have done this. So sometimes just plan it, try it, and then see if you can stick to it. I think also picking things you like to do, obviously that's going to be really important as well. I think of it too as a way to try something new. So even as simple, I've mentioned walking a few times. Maybe it's that you've never walked, you know, here in Hamilton, maybe you've never walked by the waterfront. Well, I could set that as my goal so that I go for a short walk by the water, so that I try a new place. And maybe that, you know, is a different kind of motivation, not the exercise part, but, you know, check in, just a new place. The other thing that you're already doing is there's things you can educate yourself first. So you can learn about things, you can learn about resources, you can learn about why it's important, you can try to figure out what are the reasons that make sense to me. So that's what one of my goals is here today, is to help you start to think about, why do I want to do this? Because I could sit here and tell you all the important reasons that I think or why I exercise, but that doesn't help so much, because we're all different and we all have different things that make sense for our own person. So better experts than me have talked a lot about some of the health benefits of exercise, and I'm just going to show you a really short video. You may have seen it before. You may have heard of Dr. Mike Evans. He's a doctor who really has promoted a lot of pretty simple concepts within healthcare, but he says them in such a way that it's like, wow, of course, why didn't I think of this? It makes sense. So sometimes it helps to watch those kinds of things, learn about what are the benefits of exercise, not because someone's telling you this is important for you, but you could pick out maybe one thing he says is like, oh yeah, that's on my radar. I want to make sure that I can work on that health issue. So I'm going to share with you his video. I'll tell you that it's less, I'm just going to show the first bit. It's a 10-minute video. I'll give you the link in case you want to watch the whole thing or see some of his other videos. I'm just going to share with you the first 3, it's under 3 minutes, just a little shy of 3 minutes. So yeah, so I'll get that started and then I'll give you the link afterwards too. It's just on YouTube. So here, I'll copy this now. Full screen. There we go. So like I said, I'll be back in about 2 minutes and 45 seconds.
I'm Dr. Mike Evans, and welcome to this visual lecture I'm calling 23.5 hours. So I have a big interest in preventive medicine, you know, which can mean a lot of things, from, you know, cancer screening to eating more fiber to having a good social network. And I mean that in the old sense of the word. But weighing less, drinking less, smoking less, controlling your blood pressure, cholesterol, and so on and so forth. So all these things are incredibly important, and I wouldn't want you to minimize your efforts in any one category. But I want to know what comes first. What has the biggest impact? What has the biggest return on investment? What makes the biggest difference to your health? So I did my research, and I found an answer, at least for me, and it's tricky because, you know, all these things are sort of overlapping. But I picked out this intervention, and because of its breadth, it worked for so many different health problems, and that's what I found so cool about it. So just to kind of walk you through a quick list. So this intervention in patients with knee arthritis who receive 1 hour of treatment 3 times a week reduced their rates of pain and disability by 47%. In older patients, it reduced progression to dementia and Alzheimer's by around 50%. For patients at high risk of diabetes, and coupled with other lifestyle interventions, it reduced progression to frank diabetes by 58%. Postmenopausal woman who had 4 hours a week of the treatment had a 41% reduction in the risk of hip fracture. It reduced anxiety by 48% in a big meta-analysis. Patients suffering from depression, 30% were relieved with low dose, and that bumped to 47% as we increased the dose. Following over 10,000 Harvard alumni for over 12 years, those that had the intervention had a 23% lower risk of death than those who didn't get the treatment. It's the #1 treatment of fatigue, and of course, the kind of outcome of choice there, my favorite outcome is quality of life, which is really all of the above and really about making your life better. And this treatment has been shown over and over again to improve quality of life. So the question is, what's the medicine, and what is 23 and a half hours? So the medicine was exercise, mostly walking, so not triathlons. And let me just put it a different way. I think what I'm asking you to do is, if you think about your typical day, so there's 24 hours, and so you might spend most of your day, this varies obviously, but couch surfing, sitting at work, obviously sleeping. And what the evidence that I'm going to show you kind of tells me is the best thing you can do for your health is to spend half an hour being active, maybe an hour. And that if you can do that, you can realize all the benefits I've described in the previous slide. So let's just take a quick walk through some of the literature.
Okay, so that's Dr. Mike Evans, and that is the quickest summary I can think of that it really goes over some of the overall benefits, some of the specific benefits, the health conditions that are improved. So I've shared the link there in the chat. So if you want to watch more, and he has lots of videos on different topics, which are equally impressive. So I think he got at some of the things I already said. So I said how sometimes we think about how much exercise we have to do, and that's intimidating, but he broke it down pretty reasonably, this 23 and a half hours. So if I can just spend 30 minutes a day moving, bit more with a bit more effort, I get some of these benefits. The more I do there's a maximum. So if I do a little more, I get an even bigger response. He listed a lot of different conditions that it helps. So he talked about a lot of physical things. He talked about some mental health things that exercise can be helpful for. And then he also talked about overall quality of life. And so if you're able to do more things, you're usually going to get a bit more pleasure or get a bit more enjoyment out of your everyday. So those are all really good reasons. And for everybody, there's some that make sense to you and some that don't. So it's a helpful exercise to go through and try to think about, why is this important for me? What are the hard parts? What are the good parts? So just to really think about it. And I'm going to take you through that next. So this is something I'm going to do it, but it's super easy to do on your own too. And if you have anything you want to add in the chat, you can go right ahead and just pop anything into the chat. I feel like, I hope my connection is working here, some things seem to be on pause. So I'm going to share a pro and con list with you. So that's a pretty easy tool. You can write it down. You can kind of do it in your heads. I find it helpful to write it down so that I remember what I said when I come back to it, like when I have to think about it again. So let's just do that together right here. So just ask myself, should I be physically active? I'm just going to make sure I can see the chat in case anyone has anything to say. Yeah, so here I have my pro and con list. And so again, this is going to look different for everybody. So I'll share with you some of the things that make sense to me, but also some of the things I hear pretty frequently. I hear the downsides a lot. That is true. So I tend to start on that side. So what are some of the difficulties? What are some of the cons? Definitely, I think everybody hears about, I don't have the time. So yeah, that's definitely an issue. Or very simply, I don't really want to. That's definitely a big factor. That's what we talked about with motivation. And then I think something else that's really important here is I don't have the energy. So this idea about energy, we're going to break some of these down a little bit more after too. So those are definitely some important things to consider about what makes maybe being active difficult. But then on the other side, you have, well, why should I? What are the benefits to me? So again, Dr. Mike Evans, he mentioned a lot of different health conditions. For me, some of the everyday activities that are easier if I'm active is actually, the biggest one for me personally is sleep. So I sleep better if I've exercised. So definitely if I have a couple days where I haven't been active, I do try to get out, even if it's for a bit of a walk, a bit of a longer walk. Then I'm a bit more physically tired and I do tend to sleep better. So for me, that's a big one. on the everyday level. But then you also have the overall health conditions. And I think some of the most impressive ones he mentioned, one that I didn't, I learned this more recently, one that I didn't realize, but it can help with, prevent or delay dementia. So I thought that was really interesting. And so I did a lot of work to figure out why this was true. So not necessarily make it not happen, but it might start later. So it's really helpful for that. For some people, of course, they have different health conditions. So one we hear a lot about is helps you have a healthy heart. So good for preventing or managing any cardiac issues. Same with lung issues. So we're going to talk about those a little bit too. And then even though we said on the con list, don't have the energy, one of the best things exercise does is it gives you energy. So it's on both sides, and fair enough. So it definitely does appear on both sides. Some of the other things that are really helpful, maybe relevant to today, is that exercise actually boosts your immune system. So this is a great one right now when we're thinking about how do I stay healthy in the face of an infectious disease. So that's one that is an interesting one. But then you might even have some simple everyday tasks, again, like for me, sleep. But maybe if you exercise, the stairs get easier, right? So you notice that some of your activities, stairs get easier, I can carry my groceries better or easier. How do you carry them better? Yeah, so, some tasks get easier as well. So those are definitely some of the things that I hear a lot. And one of the points of making a list like this is that if you can identify for you what's on either side, then you can maybe make a better plan. So if I look at what's on the downside, well, if I don't have the time, then I can really look at that, or I can make a better plan. Like, well, but I do always have time on Saturday, right? So that's a great place to start. Don't want to. So then again, that's a pretty hard one, like we said, with motivation, but I can try to address it. And then don't have the energy. Again, if I learn, or if I even make a better plan again, well, I tend to be tired by the end of the day. So maybe if I'm going to add some activity, it's going to be earlier in the day, or on the day where I don't have much else to do. So you can make a bit of a different plan. I'm not saying that you kind of erase them, but maybe it helps you rethink it. And then same with by identifying the things that help you want to exercise, it just builds up how important this is to you, and you realize, oh, that's some pretty good, those are some pretty good benefits. And then it might be that little extra push to getting started. So that's some of the reasons I suggest doing your own pro and con list. And then those are some of the things that you may find, some ideas that are pretty common on anyone's pro or con. So hopefully that's a helpful tool for you. Simple, the pro and con list just keeps on giving. So that's one thing that you could try on your own after today. All right. So I do want to explain a little bit more some of the science behind what's happening to your body when you exercise or when you're active. And we'll talk about some of the things that, Dr. Evans said in the video. We'll break down some of the things that I just said on the pro and the con list. We'll start with the things that I think make the most sense to people, or the things that come to mind when I first say what happens to your body. So we know that things change at the tissue level, right? So classic with exercise, we think about our muscles. Or if I work out, I'm going to build a muscle. It's going to get stronger. It's going to get bigger. Very true. That will happen. If you use it, your muscles will get stronger. Along with that, muscles need other things to work. So blood flow. So your heart is a muscle. So yes, you can build the muscle. You can get your heart to be stronger. You can also have that better circulation, right? Because if your heart has to work a little harder, that blood flow circulates a little bit better. As well as this is the energy. We're going to link it to the energy part. For both of those reasons, exercise is something that in the long term builds energy. So yes, it takes energy to do it, but in the long term, we're building our muscles. In particular, we're building our heart muscle, and then our body gets more efficient. And if our body gets more efficient, it takes less energy to do the same thing. So that's why I say the stairs get easier. So if I do the stairs extra as exercise, my body starts to build the right muscles that help me do the stairs. My heart has a bit more capacity, so it gets easier from a couple fronts. Yeah, and it starts to take less energy. So that is pretty neat. Yes, short term takes energy that day. So that's also why it's important to make sure you're drinking your fluids and getting the right nutrition, eating well, a healthy, balanced diet, getting sleep. So these things help you have energy every day. And then exercise is something that helps you have more energy to spread around all the things that you want to get done in the day. Yeah, so as we practice, it does get easier. Definitely that is true. First couple times you do something new, you're gonna be sore. It is normal to have some muscle soreness, right? That's part of the process of building muscle. It's good to find things, that's why I say small doses too, the 10 minutes, because if you go all out and do a huge big exercise binge, and then you can't walk for a few days, I think it'd be pretty tough to want to do it a second time. So better to start small, better it's too easy the first couple times, and then, oh, but I have a habit now, or, oh, actually my muscles changed. So these things change little steps. So if I do a little bit, then I get a little stronger. A little bit more, I get a little bit stronger. But if I do a lot and then it just hurts, and then I don't do it for a week or two, I don't really get the opportunity to do that building blocks. So a little bit at a time will help us build muscle and help things get easier. So the practice here is the key point. So we've talked a little bit about our heart. Of course, our lungs too become more efficient as well, and our tissues of our body. Dr. Evans mentioned osteoporosis. So exercise is good for bone strength or bone density as well. So some weight-bearing activities, some resistance exercise, so actually lifting some weights or using exercise bands, doing things like that can help with our bone density as well. So those are some of the tissue things that happen. But like I said, your muscles use a lot of different systems. So we also use our nervous system, our nerves, and then I'm going to link that to our brain as well. Movement and exercise do use a lot of nerves because you've got to have the signals that say, okay, let's work this muscle, let's relax this muscle, let's be coordinated. That's how our brain starts to get involved too. Purely through activity, but then of course, if you're trying to make your body do a certain thing, right? Whether it's a simple, movement with the weight, you have to think about how your body's moving. So lots of connections are happening in your brain, as well as just being active does make a lot of connections happen in your brain, and that's one of the reasons that it can help with this delaying the onset of dementia or reducing how significantly affected someone is. So that regular exercise can help a lot with our cognition. And I think the other thing to think about here is, like I said, if I have to think about my movement a little bit, then I'm creating more connections and I'm building. I'm not doing a great job of explaining this. We are capable of change. So our bodies are, we say, there's a fancy term for this when we're talking about nerves, it's called neuroplasticity. Neuro meaning nerves, brain, things related to that system, the nervous system. And then plasticity, plastic is bendable, is moldable. So it's an old word for change. So as we use and have all those connections going, we are creating change in our bodies. So things that fire together actually wire together. So I say that because movement creates lots of connections. So that's a fire together, wire together thing. And then you can add another layer. If you're doing an activity you enjoy, then you're also adding that circuitry in at the same time. So this can be a really powerful thing Part of that is you may have heard of the runner's high, or this feeling good with exercise, and that's partly what's happening. If your body gets used to something and you feel good for having done it, then you get that feel good, that feel good feeling just for having gone out and getting started. Definitely exercise releases some of the feel good chemicals that are involved in mood. So you may have heard of these feel good chemicals like endorphins, and I don't know why the other one is escaping my mind. Anyway, these feel-good chemicals do get released. They're more available in our body. So if we've been struggling with mood issues, like if we've been feeling down, if we have depression, if we're in a low mood, sometimes it's the availability of those feel-good chemicals is too low. So exercise can help boost our mood through just having that more available. But then you also have the logical part. If I do something I enjoy, then I might also have I might feel a bit better, even if it's temporary. And then you also have a lot of discussion in the past couple of years about forest therapy. So even going for a walk in nature, a park, a green space, just being in nature has been shown to have a connection to improving mood in that sense. So exercise does help in both a physical sense in terms of our mood, but it also helps through our behavior strategies too. And I think, I don't remember if Dr. Evans said this too, but it also connects to anxiety. So exercise can be a great way for managing stress, but also specifically anxiety. So on the one level, exercise activity can be a break. For me, as soon as I started staying home, devouring the news in March and April, I'd get pretty stressed out by the end of my day. So I did try to go for a walk. I'd be working and then I'd just read too much news, and then I'd go for a walk, and it did help a lot. It helped me put a dividing line in my day so then I could try to relax over the evening or not think about COVID-19. So that was a really helpful strategy just in my time dividing of my day. And then of course, having time without as much stress is definitely helpful for our bodies and our brains in lots of ways. So there's that part of exercise, but also with stress and anxiety, one of the things that happens is sometimes, you feel like tightness, or you feel like your heart is, racing a little bit, your heart rate is up. You might start to breathe a little bit faster when you get stressed out. So having a time, even if it's a few minutes, where you are regulating your breathing so you can focus on it and try to slow it down, that can help. Of course, exercise speeds it up, but it's on a regular, you have this kind of more regular pattern to your breathing. So that some of the physical manifestations of stress and anxiety can also be dealt with through light or moderate activity. I think that also connects us to mindfulness. So like I said, if I'm thinking about using my muscle to get something done, I'm making more connections. But it's the same with mood too. If I'm taking a moment, we talked about mindfulness also in the media for a long time, not meditation, but mindfulness, which is an awareness of what you're doing. Kind of stop and smell the roses, notice what's going on around you. Exercise or activity can be a great way to engage in mindfulness. You're taking that 10 minutes or less or more, and you can notice what's happening in my body. How does this feel? Do I feel strong? Is this challenging? Do I feel, how's my balance? I can even just think about the world around me. So the senses, what do I smell? What can I touch? Do I feel hot? Do I feel cold? So because we're focused on an activity, we can be a bit more mindful about just what's going on in the moment. And sometimes that's a really great strategy for giving yourself a break from the daily worries, the daily stress, and everything else. So I think the important part there is that mindfulness is noticing what's going on without judgment. So just noticing, taking it all in, observing, right? So I think those are some of the key connections with exercise, and really explains a lot of the things about why it's helpful. So between the mindfulness part, between the change in your tissues, between the changes in your nervous system, it really adds up to a lot of helpful management of health conditions or prevention. So it's great. And then if you can enjoy what you're doing, even better, right? So you get even more out of it. If exercise always feels like the homework you don't want to do, then it's probably harder to keep doing it. It's probably harder to make it a lasting habit. So that kind of turns us to our last part of strategies here, is how do I actually, we talked a little bit about how do I jumpstart this process, but then the other part too is how do I make this a habit? How do I keep doing it? Great. Let's say I went for one walk. Great. And how do I do it more regularly? Because it's the regularity that gives the health benefits for sure. And then I think we're in a more challenging time. So I gave this title, Staying Active at Home. With the COVID-19 pandemic, we're starting to go out a little bit more now, but we've all been advised to stay home as much as possible. And, go to the store fewer times, try to get all your errands in one go, which is, these are great strategies for preventing, an infectious disease from going around, but I definitely am moving less. So what I've noticed is I do exercise regularly, and I've been able to keep that up for the most part, but it's harder than it was. So this is something to keep in mind too. I talked before about how practicing an activity makes it get easier over time. So if I practice it, my body gets more efficient. It starts to feel easier. It starts to feel easier to do other things that require my muscles and energy. However, if we haven't been moving much, what we did maybe in March is now going to feel harder. So for me, I am sitting more than I usually do. Usually in physio, I'm up and down and testing strength and showing you exercises, and I'm not doing as much of that. I also used to either take the bus and walk like a kilometer to work, or I would bike to work. And I'm not getting that in as often. So starting to now, but that I think definitely I noticed that even my regular exercise that I was already doing started to get harder. And I think that's part of the reason. I mean, stress, there's other factors in there too, but definitely my general activity level has gone down. My phone at the beginning was definitely busy telling me how, ooh, you've walked much less this week than last week. And then much less this month than the same month last year, and things like that. So definitely I was noticing how I was taking fewer steps in a day, just from the basics of, go to the grocery store and browse, or go, shopping, or different things like that. So just important to appreciate that we are getting a bit less activity and movement in from those like incidental, just part of our usual day. That's definitely looking different right now. For some people too, it's the change in routine. A lot of habits, we're so used to our routines that sometimes just a big change there and new habits didn't stick or didn't form with the new routine. So that's another thing just to really consider. And that definitely, it comes back to what I said, start small. Start with something that seems pretty simple, so pretty easy, pretty doable. So next up, I'm going to walk you through how to set a goal for yourself. So how to decide where should I start, and then to lay out, a strategy for, okay, I'm going to, say how many times I'm going to do it and that kind of thing. And then how to ask yourself, is this a good idea, or have I bitten off more than I can chew? So I'm going to take you through that. And again, this is an activity goal setting that you can do on your own. So, and you can do it for different goals. You can do it for lots of different things. So let's go back to my little PowerPoint. So let's look at the whole slideshow. There we go. So if we look at goals, setting goals, we want them to be pretty specific, and we want them to be realistic. So you may have heard this term, SMART goals. So that's what we're breaking down here right now. We're going to try to talk about how to make your goal a SMART one. So again, just let me get the chat. Where'd it go? In case you, okay, I can't see it. I will come back to the chat if you have something to say. Sorry, I can't see it while I'm doing this one. So SMART goals. So SMART stands for specific is one of them, and there's an R in SMART. That's the realistic. The M is measurable. So how do I actually measure that I've done my goal? How do I know I've, and then A, achievable. So it's kind of also realistic. And T, time. So we're going to make it time specific, time sensitive. So first question, what am I going to do? Am I someone who does like to go for walks? Is that appealing to me? It's a pretty easy one right now. Our options are a bit more limited. Maybe I'm someone who likes to follow a class. So maybe I can find a video or I can find an online class. Or maybe I want to start with stuff that I already like to do. So this time of year, a lot of people end up in their garden, taking care of the lawn, things like that. So those are a few ideas of where you could get started, depending on what appeals to you. I did make a goal, and this is true. So when I started working at my current office, I thought, well, you know, it would be smart to try to get out for a little walk on my lunch breaks. So that's kind of what I said. Okay, I'm going to go for a short walk on my lunch breaks. I'm getting to the next. I put a few steps in one. So when? So when am I going to do this? And like I said, for my walking goal, it was just to add a bit of activity in through my day. So I said my lunch break. You know, no excuses, right? Like I have the time. I could take 10 minutes of my lunch to walk. But this might also, when might be like what day of the week, or is it morning or is it afternoon? Like I said, some people are early risers or have all their energy in the morning. Some people are night owls and they have more energy then. Not that I recommend exercising right before bed. It might keep you up, but a few hours before bed, like in the evening. So thinking for you what works, excuse me, is definitely an important part. It gives us the T, or time part of our SMART goal. And then how much should I do? So when I ask myself for my lunchtime goal, you know, I can't say I'm going to go for an hour walk because my lunch is an hour and I have to eat and I don't want to be too hot. And I might have to do something else too. So I told myself 10 minutes, even just get out for 10 minutes. I could make it kind of around a block or two. So that gave me a manageable, I felt like that was manageable and realistic. So the other thing you might ask yourself here is how much do I know I can easily do right now? So really, if I think about, I've definitely, even if we stick with this walking idea, I've definitely spent 10 minutes walking when I go out for errands. So then that also is a good way to say that's realistic then. So if I'm already doing 10 minutes, then let me start there. So rather than saying I can walk an hour, but maybe maybe I haven't walked an hour in years. Like I don't typically go for hour-long walks, so that would be a new thing, and maybe I'm not that sure. So that's one way you can think about how much. Maybe you have gone for that longer walk recently, but you were really sore after for a long time. So that might be an indicator that it's a bit too much for a starting point. So you can ask yourself, like I said, what do I already do that seems reasonable? And one way you can decide if it's reasonable is how do I hurt? So if I do something and it really hurts during, that might not be a great idea. It might hurt a little bit. Exercise is work and effortful, and it might be a little sore, but it shouldn't be a ton sore. So it shouldn't skyrocket my pain level. Also, you can think about how long does it take for me to recover. So if this is like, yeah, you know, last fall I went for an hour walk, but it took me days for my legs not to be sore. It took me days to feel like I could go back to my usual. Then that's a bit too much as well. You want to return. You might feel like you're working hard. You might feel a little bit sore, but you don't want it to wreck the rest of your day or to wreck your sleep. So you think about what can I do and still return, like feel reasonable in about an hour or two? So I can sit down and rest, and then in an hour or two, I'm kind of feeling back to my usual. So that's another thing you can ask about yourself to decide how much, what's too much, what's enough. So that's the other part too, is how hard am I working? Like we said before, with the light and the medium and the hard. So like I said, most things you want to aim medium. Light is a great place to start if you're not sure. So for me, because it was on my lunch break, I think I was aiming for just light. So here we go. Here's my goal written in a sentence. So I'll walk for 10 minutes, 7 days a week at light effort in the afternoons. So I hit all my benchmarks. Yeah, it's pretty specific. It's got my times. It's got when I'm going to do it, how hard I'm going to work. Right. So there we go. We have a goal. The next thing I can ask myself is this a reasonable goal? Am I actually going to get this done? So you can ask yourself, how confident am I that I will do this in the next week? So when I ask myself that question and I can give that a scale, I can say, okay, like 0, not at all confident. No way I'm going to get that done in the next week. 10 or 100%, I'm 100% sure I'll get that done next week. So when I look at this goal and I ask myself, how confident am I that I'll get this done next week? I'll be very honest, I'm probably 50-50. So I'm probably 50% sure that I can get it done. So that's okay. We want to aim for 70% sure that I'll get it done. So 50-50 is not good enough. So I have to change this and make it a little bit easier, or just change it enough that it seems like I'll be 70% sure I can get it done. So that helps you be a bit more specific and realistic. What would I change about this goal? So I can tell you right away, the 7 days a week stands out to me as I'm never going to do something every day of the week. I even said this was tied to work. So 5 days is already a little bit more reasonable, but I'm the kind of person, I need that little bit of insurance that if I don't feel like it one day, it's okay. So excuse me, the big thing I would want to change here for me is to make it 4 times a week, maybe 3, depending on, but I'm okay with saying 4, just to give me that one day a week. Weather might keep me away, and that's okay. I might not feel like it. Something else might come up. So I need to have a little bit of insurance. So if I change that to 4 days a week, I am much more confident. I'm probably 80% now. So by saying 4 days a week, my confidence went from 50% confident to 80% confident. And that means I have a goal that's realistic. So that's a great question you can ask yourself. How sure am I that I'll get this done next week? And if then you try to figure out, oh, if I change this, I'm more confident. If I change this, I'm less confident. And you want to be more confident. So why is that? Why do we want to be more confident? You can imagine there's a couple reasons that you want to be confident in your goal. If you set something as your goal and then you don't get to it, it doesn't happen, that does not feel good. And that makes us, again, less likely to come and do it again, try exercise again. But if I set an easy goal and I do it, well, then I get a little bit more of that feel-good chemical. I can be proud of myself and be like, check that box. Checking the box usually feels pretty good. Some people do write this down on their calendar, and all you have to do is a little check box. I got it done all the days I said I would, or as many times as I said I would. So you want to start small for that reason, as well as what I said before. If you start small, you can build it. So maybe you set that goal and then you realize, I want to get more out of my walks. I'm going to change it so that I'm working at medium effort. Or I'm going to change how long I'm walking for. So you can absolutely change a goal later on and make it a bit more challenging. But I recommend starting with something that seems pretty easy and get it checked off a few times and then think about, okay, I can do a little more. When you are adding to a goal, I recommend thinking about only adding it like 10% at a time. So I wouldn't change from walking 10 minutes to walking 20 minutes unless I really undershot my activity. But rather I would switch to maybe thinking about, okay, I'll do 11 or 12 minutes, and I can build that up every week. And then if my goal was an hour, I will get there. Because of course, then once I'm walking 25 minutes, I might add 3 minutes, 4 minutes, 5 minutes. So thinking about that 10 to 20% increase, excuse me, is a great way to not bite off more than you can chew. So that is my advice on goal setting, and hopefully that's a little bit helpful. It really breaks it down, and then you see that you have so many different parts of it that you can control, and it's not just this 150 minutes exercise, go, right? So we really need to break it down to make a plan. So hopefully that helps a little bit. A lot of people do like tracking it, and that definitely helps. You can see where you've come, and you can see what's getting easier, and you can see you know, maybe you want to try something new, and you can set it up with the same framework. So that's the strategies I want to share. And lastly, I've shared 2 resources so far, but I have 2 other resources that might help you get started. So I will show you 2 websites and put the links in there for you. So here we have, just give me a second and it will, there we go. Okay, so this website is from BC, so Gentle Movement at Home. This is a great place to start for movement, just keeping things mobile, keeping things moving. And these are online webinars, and they're free. And they have their videos available later on a YouTube channel. So here it says access the recordings from previous sessions. So that is a great, excuse me, a great resource for adding in some movement at home. And then I'll put that in now. No, it's not saying it. Okay, and then the other one I wanted to share with you is the Y. And this one is the Hamilton Y, but all, like YMCA of Canada has a program called Thrive, so you can look that up too. I just like, because it's Hamilton. So this one is called whywearehere.ca. And when you get here, you have a few different categories. So I'm really thinking about work out your body here, but the other ones are worth looking at too. And then, oh, I guess that's not working for me right now, but the Why We Are Here under body has some videos, has some exercise videos. There we go. So just like some of them are 20 minutes, some of them are sitting in your chair, some of them are up and moving, some of them are stretching, some are balanced. So it's a great place to start. And you know, if you're not sure, watch it first. You don't have to do it. You're just doing it from the comfort of your own home. So you can try watching it and see what will work for you. So as I put these different links in the chat, excuse me, I have dry throat now, I'm going to launch a little poll. So if you have a minute, just take a second and just give us some feedback about your thoughts about today. Excuse me. So that should have popped up for you. And so I'll get the other, oh, it's not launching, is it? There we go. So I've launched that. So if you have a minute just to answer those questions about today, that would be great. And I will get the other website for you. And of course, if you have any questions, just ask in the chat. I have come close to our full hour here. I don't know, I was chatty today. So I put that link to the Y there as well. Yeah, I can definitely stay on for a couple more minutes. So if you have any questions, if you have any thoughts, please do share in the chat, and then take a moment, you know, click the links, copy them so that you have them if you want them. Yeah, because they will be gone once we're gone. And well, I can't thank you enough for spending, you know, part of your day with me. So I appreciate that very much. And I hope that something from today was useful for you, or, you know, kind of set off some thinking around being active. So thank you again. And please do come back. There's lots of other sessions through the week. I'm here, I do a different one on Thursday, so I alternate between active and talking about pain. So that's interesting. I'll be here next Thursday talking about that. All right, well, thank you very much as well. And thanks for doing the poll. And that is everything for today.